Right now, 16 of the 18 Americans evacuated from the cruise ship at the center of the hantavirus outbreak are at the National Quarantine Unit of the University of Nebraska Medical Center, nearly filling 20 individual rooms, including one American who tested positive for the virus. 2 others were taken to Emory University in Atlanta. But the message to the public is, don't freak out.
No one who poses a risk to public health is walking out the front door of the streets of Omaha or beyond.
Let me be crystal clear. The risk of hantavirus to the general public remains very, very low.
Joining me now is Saira Madad, infectious disease epidemiologist at Harvard's Belfer Center for Science and International Affairs. MS Now's Josh Einiger is here as well. Josh, tell us about this place in Nebraska. I've been getting this question a lot over the weekend, and what the weeks ahead might look for these patients.
Yeah, well, Chris, people who've been paying attention to these issues, certainly going back through COVID and before then even to Ebola in 2014, are familiar with this place. It's called the National Quarantine Unit. And we have file video of what it looks like inside. It's 20 rooms with special air handling facilities, and it allows for people to sit in what is described, actually doesn't look like here, but what is described as a hotel-like setting. That's not what this video looks like, but I think they also have settings that appear to be more like a hotel room, and it's for people who may not be symptomatic, may not be a specific risk, but who have to quarantine just in case they might end up converting to be positive with whatever is of concern, in this case, hantavirus. We can show you what they said earlier today about this facility and how it's treating these people today.
Our quarantine unit is designed for well individuals who need to be monitored. It is not a patient care space. It is much more like a hotel than a patient care space. We don't have the typical things that you would see in a hospital room. It's a much more comfortable environment, actually, with some things that to help keep people comfortable, like exercise equipment, and it's a larger space, TVs and things like that.
So 18 of these patients, we should call them passengers, who are being monitored right now. They're currently in quarantine in that facility. We don't know, Chris, if they're all going to end up staying there for the full 6 weeks, or if they're perhaps going to end up going back towards their home states to a similar facility, perhaps closer to home. But here's why this is so important. There were 5 people of French nationality who came off that boat and were repatriated back to France. On the flight, one of them developed symptoms and is now said to be in pretty bad shape. So it is still possible for this whole period of time for any of those 18 people to develop symptoms, and that's why they have to be quarantined for that long, according to all these doctors.
Thank you for that, Josh. So, doctor, how long and how sure can we be as we look at the quarantine for these passengers?
Yeah, well, the incubation period is anywhere from 2 to 42 days, with a mean of about 18 days. And so we are still in that incubation period. So it's not surprising that we're still seeing cases tied to this exposure event. We'll probably see potentially more confirmed cases in the days to weeks ahead because, as I mentioned, we are still in the incubation period. What's important is that we haven't seen any secondary cases, meaning from those initial set of cases, have they exposed anyone else? And so we haven't seen that. And so that's good news. And so right now, the strategy very much is containment and monitoring, and then doing that risk-based assessment.
We have continuously heard, doctor, we should not panic. We played that sound. This is not another COVID. And yet, the images we see are these Americans coming off planes wearing masks, blue PPE, put into quarantine. In some cases, we saw people being sprayed down. Do the optics make it hard to reassure people everything is fine, or should the optics help them understand everything is fine?
I think it's really the latter. It should help them understand the seriousness of the situation and how these public health entities are taking this seriously. And because, as you've mentioned in the video, none of these individuals are out and about that have repatriated and now back in the United States. And so there is a plan in place to continuously monitor them. And a lot of these precautions that are being taken is out of abundance of caution. We know how, this virus is being transmitted. We are still learning more. So the evolution of this virus and the dynamics are still being understood. And so a lot of these are just precautionary measures.
Yesterday, the acting CDC director said that they are fully equipped to handle any potential hantavirus outbreak. But of course, it comes after the Trump administration laid off thousands of CDC scientists and public health professionals, including members of the agency's ship sanitation program. Are you worried? Are doctors who you talk to in your field concerned about the CDC's ability to handle this right now the way they have in the past?
That's an excellent question. And I think there's two things that could be true at the same time. First is that the dismantling of the public health infrastructure in this country is a huge, huge problem. We need to make sure that we are having, the full capacity behind this current epidemic. We don't want it obviously to get worse. It's a bad situation. We want to prevent it from getting worse. And so making sure that we have, the staffing that we need, the infrastructure that we need is really, really important. And as you've mentioned, the gutting of public health in this country in the past, few months is very relevant. At the same time, I do want to mention the current individuals that are working in this multi-state effort. These are the clinicians, the public health officials, the transporters, the responders, working around the clock to ensure the safe and effective repatriation of these passengers, the safe monitoring in the current quarantine unit, as well as we kind of look at in the next days to weeks, if they're going to continue to be transported either in their home or their state. This is a lot of work and it's heroic work. And so I want to thank them for what they're doing. This is a lot of coordination happening behind the scenes. A lot of folks just kind of see the vehicles and the ambulances, but they're not seeing the people kind of working to really make sure that this is happening safely and in coordination.
Dr. Saira Madad and Josh Einiger, thank you both.